Hello everyone, today we'll be discussing autism spectrum disorder. Autism spectrum disorder encompasses a spectrum of neurodevelopmental disabilities. This spectrum is characterized by repetitive patterns of behavior, interests, activities, and problems in social interaction. So we need to know autism spectrum disorder is a spectrum of conditions, so it's not just one disease. This includes conditions that were previously considered separate. So the spectrum consists of autism, Asperger's syndrome, childhood disintegrative disorder, and an unspecified form of pervasive developmental disorder. Etiology: the cause is still unknown, the onset is variable, and the development is insidious without a clearly demarcated onset. Children that have an autism spectrum disorder have an increased risk of having epilepsy. However, there is no causal relationship that has been identified. There is one subtype of ASD which you mentioned earlier, childhood disintegrative disorder. We are going to discuss more about this in the upcoming slides. History and physical examination. The symptoms of ASD are usually identified by 2 years of age, especially for childhood disintegrative disorder. 1/3 of children experience regression of skills at the same time, and children with childhood disintegrative disorder generally have the worst outcome among individuals with autism spectrum disorder. A child affected with childhood disintegrative disorder shows normal development, and they normally develop age-appropriate verbal and nonverbal communication, as well as social relationships, motor, play, and self-care skills, as compared to same-age children. However, what we need to know is that by the age of 2 to 10 years, they almost completely lose their acquired skills in at least 2 of the following functional areas, which can be in receptive language skill, expressive language skill, social skills, bowel and bladder control, motor skill, or play skills. Diagnostic criteria of autism spectrum disorder. ICD-10 criteria for childhood disintegrative disorder diagnosis. So, normal development up to the age of at least 2 years. The presence of normal age-appropriate milestones are achieved in the areas of communication, social relationships, play, and adaptive behavior. A definitive loss of previously acquired skills at the onset of the disorder. So, as I mentioned earlier, the diagnosis requires a clinically significant loss of skills in at least 2 of the following areas. So that is expressive or receptive language, play, social skills or adaptive behavior, bowel or bladder control, or motor skills. Qualitatively abnormal social functioning manifests in at least 2 of the following areas. Qualitative abnormalities in reciprocal social interaction, qualitative abnormalities in communication, restrictive, repetitive, and stereotyped patterns of behavior, interests, and activities including motor stereotypes and mannerisms, and general loss of interest in objects and the environment. And we also need to take note that the disorder is not attributable to the other varieties of pervasive developmental disorder, acquired aphasia with epilepsy, elective mutism, schizophrenia, and Rett syndrome. DSM-5 diagnostic criteria. So A. Persistent deficits in social communication and social interaction across multiple contexts as manifested by the following. So we need to note the examples that are going to be mentioned here are illustrative and not exhaustive. 1. Deficits in social emotional reciprocity, ranging for example from abnormal social approach and failure of normal back and forth conversation, to reduced sharing of interests, emotions, or affect, or failure to initiate or respond to social interactions. 2. Deficits in nonverbal communicative behaviors that are used for social interaction. For example, from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and body language, or deficits in understanding and use of gestures. 3. Deficits in developing, maintaining, and understanding relationships. For example, from difficulties in adjusting behavior to suit various social contexts, to difficulties in sharing imaginative play or in making friends. B. Restricted repetitive patterns of behavior, interest, or activities as manifested by at least two of the following, currently or by history. 1. Stereotyped or repetitive motor movements, use of objects or speech such as simple motor stereotypes, lining up toys or flipping objects. 2. Insistence on sameness, inflexible adherence to routines, or ritualized patterns of verbal or nonverbal behaviors, such as extreme distress at small changes, difficulties with transitions, rigid thinking patterns. 3. Highly restricted fixated interests that are abnormal in intensity or focus, such as strong attachment to or preoccupation with unusual objects, excessively circumscribed or perseverative interests. 4. Hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment, such as apparent indifference to pain or temperature, adverse response to specific sounds or textures, excessive smelling or touching of objects, visual fascination with lights or movement. Evaluation. So, children that are diagnosed with childhood disintegrative disorder rarely reveal an underlying neurological or medical cause. So, a complete medical and neurological examination is done, and tests are done to exclude reversible causes of the condition. So, the tests that are done include a complete blood count, urine electrolytes, liver function test, thyroid function test, heavy metal levels, HIV testing, urine screening, neuroimaging studies such as MRI or CT, EEG. Treatment or management. Treatment for childhood disintegrative disorder is similar to the treatment of autism. So the stress usually falls on early and excessive educational interventions. And most of the treatment plan is behavior-based and highly structured. So family counseling is done, including educating the parents so that they can follow the child's treatment at home. And this is usually part of the overall treatment plan. Then there are therapies that are done in areas of language, speech, social skills development, occupational and sensory integration. They may all be used according to the needs of the individual child. So basically the overall basis for the management of autism spectrum disorder is threefold. So one is improve quality of life to maximize function, to promote a child's independence, and 3 to maximize function. Complications. Sorry, before we even get there, we also have medications that are given, okay? So medications that are usually used to treat the symptoms as they develop during the disease. What we need to know is that there is no drug available to cure this disease directly. So antipsychotic medications can be used for repetitive behavior patterns and aggression, to control problematic behavior, particularly aggression. Experts often use selective serotonin reuptake inhibitors. They can use stimulants and other antipsychotics. Complications. Epilepsy commonly develops with the risk of seizures that increases throughout childhood, with the highest seizure diathesis that occurs during adolescence. Of note is selective serotonin reuptake inhibitors and neuroleptics can actually reduce the seizure threshold and thus must be used with caution. That's all about autism spectrum disorder. If you like the video, please like, subscribe, and comment. Thank you.